Welcome, everyone, to today's CVR webinar, Mass Violence and Terrorism, Synthesizing Research and Practice Evidence from the Field. My name is Susan Howley, and I'm Project Director for the Center for Victim Research. CVR is working to help integrate victim research and victim services. Along with these syntheses of research, such as the one that's the focus of today's webinar, we also offer tools, a researcher directory, a library of reports and articles, podcasts, and more. If you have not visited the CVR website lately, I hope you'll do so later today. CVR is a partnership endeavor between the Justice Research and Statistics Association, the Urban Institute, and the National Center for Victims of Crime. We also collaborate with many other projects who are working to build the evidence base for victim services. This webinar and all of CVR's activities are supported with funding from the Office for Victims of Crime at the Office of Justice Programs, U.S. Department of Justice. And now it is my pleasure to welcome today's presenters. Melanie Langness and Emily Tiry are from the Urban Institute, and longtime victim advocate Kathryn Turman has joined as the practitioner presenter. With that, I'll turn things over to Melanie.
Great. Thanks so much, Susan. We're very glad to be here today. Good afternoon, everyone. I'm Melanie Langness, and I'm a policy assistant in the Justice Policy Center at the Urban Institute. I focus on victimization and violence, and I work to center community engaged methods and equity frameworks in all my projects. And I will say I have somehow managed to somewhat lose my voice today. So if you hear me cut out at any point, feel free to call me out in the chat, and I'll try and cough and get my throat back where it needs to be. So with that, I'll turn it over to my colleague, Emily Tiry, so that she can introduce herself as well.
Thanks, Melanie. So my name is Emily Tiry. I'm a research associate at the Urban Institute's Justice Policy Center, and I conduct research on criminal case processing and victimization with a focus on innovative data collection and analysis techniques. And now I'll let Kathryn introduce herself as well.
Hi, I'm Kathryn Turman. I recently retired just the end of June after almost 20 years in the FBI as the Assistant Director over the Victim Services Division. Spent many years before that in the Justice Department and the Office for Victims of Crime, U.S. Attorney's Office in the District of Columbia, and the Director of the Missing Exploited Children's Program. Along the way, I've had opportunities to work with a lot of victims of mass terrorism, mass violence, and their families. I'm happy to be here.
Great. Thanks so much for that, Kathryn. And so before we begin today, I'm going to give an overview of the topics we'll cover through a little roadmap. So let's go there. So I'm going to begin by giving a brief summary of the goals of our evidence synthesis on mass violence and terrorism victimization, as well as the methods that we use to review both research and practice-based evidence sources. I'm then going to kick it to Emily to go over the definition of mass violence and terrorism that we use in our work and to address some key information about the prevalence of MVP victimization. We'll then review risk factors related to mass violence and terrorism victimization, as well as the types of harms that are associated with this. Emily's then going to shift us to a discussion of responses and interventions and review the typical response framework as well as types of services available to victims following these events. I'm then going to talk about gaps in research and practice evidence and where the field may need to grow. Finally, throughout the presentation, Emily and I are going to ask Kathryn to speak about her professional experience responding to mass violence and terrorism events. We've also reserved time at the end of the presentation to respond to questions and comments from folks in the audience. We're eager to hear from all of you and are looking forward to a robust discussion, so please do submit some questions. Susan's going to help us moderate that portion. And with that, let's get started. So this synthesis on mass violence and terrorism victimization is one of a number of CVR syntheses we've done on pressing victimization topics. The purpose of CVR's Evidence Syntheses project is to assess the state of the field in crime victimization and victim response in order to help researchers, service providers, and policymakers understand and prioritize what the field needs to improve victim services nationwide. In order to select and assess appropriate sources of evidence for our synthesis, we developed a framework by drawing from the Centers for Disease Control and Prevention, or CDC's, Evidence Project. The CDC's Evidence Project emphasizes the importance of integrating knowledge from the best available research and experiential practice evidence, as well as contextual evidence too. Our primary focus was on reviewing materials available in the United States from the years 2000 to present, including research sources like journal articles and practice-based materials like reports, fact sheets, briefs, and videos found in research databases and posted by topic-relevant organizations online. For our synthesis on mass violence and terrorism victimization, we ultimately reviewed 125 research articles and 103 practice sources. Okay. There are 5 key questions we wanted to answer throughout our synthesis process. First, how many MVT events and victims are there? In other words, what is the prevalence of this victimization type? Second, what are the risk and protective factors that may be associated with MVT victimization? Third, what are the harms and consequences MVT victimization brings? Our fourth question was, what are the key responses to MVT events and interventions available for MVT victims? Finally, we wanted to ask, what are the policy, practice, and research implications of our findings? Now that we've given you an overview of our approach to the project, I'm going to let Emily start to dive into our findings. So Emily, I'm going to pass it to you.
Thanks, Melanie. So one of the first things that we did for our review process was to establish a definition of mass violence and terrorism and narrow the scope of things that we'd be looking at. So we decided to define mass violence and terrorism as intentional, high-profile acts of violence that victimize 4 or more people on U.S. soil and require the marshaling of extra municipal resources. Because we're focusing our synthesis on victimization, we wanted the definition to account in some way for the expanded service provision that is often required by MVT events. It's also important to note that these types of acts may have a terroristic intent, but it's not a necessary requirement. We also wanted to note that our definition of victims of this type of violence includes not only those who experience physical harms, but also people who experience a broader range of harms. So, for example, families of deceased victims, people who were present at the event but not injured, as well as first responders. And we also wanted to narrow our scope a little bit. So there are a few types of events that we did not focus on, including bioterrorism, cybercrime, natural disasters, gang violence, domestic violence, ecoterrorism, and international terrorism, although some of the information in this review could be applicable to these types of events. And before we get started, I just wanted to take a minute to get your thoughts on how many events, MVT events, you think occur in a given year on average. So I'll just give people a couple seconds to put some guesses in the chat box. I'm seeing 200, 1,000, in the hundreds, mostly. So it was a little bit of a trick question because one of the main things we learned from reviewing the prevalence evidence is that there is no one widely accepted definition of mass violence and terrorism. So there's also not necessarily a single widely accepted prevalence estimate. So this table is a lot of information, but it will be available in the recording that we provide later on, as well as in the final report that we'll be writing on this topic. But the table basically outlines the different definitions and data sources of common data sources that track MVT events. So as you can see, it breaks out the definitions according to the different sort of components. So you can see a type of mass violence measured. It's almost overwhelmingly mass shootings that are being measured. The number of victims that are required to be qualified as mass violence, the type of harm that people need to experience in order to be considered a victim, and mostly in these cases it's fatalities or physical injury. The location, whether it's public or could occur anywhere, and then there's also other criteria sometimes to limit it to events that occur outside of other types of crimes like gang violence or drug trafficking. And then on the right-hand side there, you can see some estimates of the average number of incidents and victims per year. And this chart shows that a little bit more intuitively. So you can see that the differing definitions result in very wide variations in prevalence estimates, all the way from about 3 for the Congressional Research Service, Mueller-Jones, and Supplementary Homicide Reports definitions, all the way up to over 300 for the Gun Violence Archive definition. So to sum up, there is no broadly agreed upon definition of mass violence and terrorism. And so that means that the prevalence results range from anywhere to about 3 every year to over 300, which corresponds to about 30 victims per year up to 1,800. And there's a couple other things that are important to note about these numbers. First, nearly all the data sources only count people who were physically injured or killed in an MVT attack as a victim. And second, most of the data sources measure only mass shootings. So all of the prevalence estimates that we have right now are probably undercounting the true number of people who experience harm from MVT events every year. At the same time, it is important to note that MVT events are relatively rare compared to other types of violent crime. And of course, we know that victimization often doesn't occur equally across all populations and communities. So we wanted to examine the evidence for risk or protective factors associated with MVT victimization. And I will turn it over to Melanie to speak to that.
Great, thanks, Emily. So like Emily said, the likelihood of victimization for a given crime really varies based on demographic or even geospatial factors. However, MVT is significantly different because these events happen seemingly randomly. There are few clear risk factors for someone to be a victim of mass violence and terrorism. Often, victims are unfortunately simply in the wrong place at the wrong time. With that said, none of the articles we reviewed discussed individual risk factors for MVT victimization experiences. Rather, most documents on individual risk focused on perpetrator-focused threat assessment. The only potential factor that may put people at a higher risk of experiencing an act of MVT individually that we found from the evidence was attending a mass gathering. First responders and members of national victim response teams, however, are called to respond to various events, so there may be some occupational risk therein, if you consider that. But the evidence around risk factors for MVT really focuses on institutional or structural factors of locations or the nature of public events. Counterterrorism and prevention-oriented organizations consider soft targets to be more vulnerable to MVT events. These are locations that are more noticeable, visible on a national or international scale, have more potential victims, and have some connection to the attackers, and they may be at a higher risk of experiencing an MVT event than others. Most, 61.4% to be precise, mass public shootings between 1976 and 2018 occurred in public places other than a school or workplace. 27.2% occurred in a workplace and 11.4% occurred in a school, according to Dewey 2020. Though people often believe that houses of worship may be safe spaces, they're actually still at a significant risk for MVT and are often uniquely vulnerable targets because they lack those emergency response and recovery plans that some other places may have. Income inequality in a given community may predict mass violence, as resource and opportunity deprivation do contribute to levels of anxiety, stress, and generational trauma that could in turn impact an individual's predisposition to use violence. The prevalence of guns is also associated with more the prevalence of mass shootings is also associated with more permissive gun laws, and higher levels of gun ownership have been found to have higher rates of mass shootings. Studies of the effects of the federal assault weapons ban from 1994 actually find that mass shooting fatalities were less likely to occur during the period the ban was active from 1994 to 2004. And just one more interesting note on institutional and community risk factors here is that Although conventional wisdom may suggest that MVT events spur similar copycat attacks or maybe inspire further harm, mass shootings are actually no more or less likely to occur based on how much time has passed since the last mass shooting. So these things don't necessarily set off a chain reaction. Okay, and so with that, we're going to shift to talk about the harms and consequences mass violence and terrorism victimization may incur. So since MVT events overwhelm local services, survivors may have a harder time accessing victim services to address the harms they might experience following the event, including traumatic injuries, other harms to physical health, psychological and psychosocial harms, economic harms and costs, and communal harms. Let's quickly highlight some things in each of these categories. Physical harms as a direct result of MVT victimization are likely the first thing you think of when you hear about mass violence. There are three main categories of MVT-incurred injuries: blast, blunt, and penetrating trauma. Penetrating trauma, which includes gunshot wounds, often requires rapid field response in order to stem hemorrhaging. Really, the injuries MVT victimization brings depends on the nature of the event itself. Other physical harms may include more invisible injuries, including those that affect the mind-gut axis and neurological difficulties. Some research shows that MVT victimization may be linked to chronic health issues as well, but more research is needed in this area. According to the National Child Traumatic Stress Network and the Office of Victims of Crime, common psychological reactions in victim survivors of all ages following an MVT event include general emotional distress, increased activity or a decrease in concentration, increased irritability or anger, sadness, withdrawal, and other changes in kind of living and eating habits, changes in sleep patterns, staying hyper-focused on the shooting or hyper-vigilant about imagined potential threats, having an increased sensitivity to sound, experiencing avoidance, experiencing major depression and anxiety disorders, including post-traumatic stress disorder, alcohol or substance abuse, and grief, including prolonged and complex grief. These psychological and psychosocial harms can be the most difficult to recover from for many MVT survivors. Because MVT co-victimization rates are significant, or what that means is that parents and family members of MVT victims or victim survivors may also be victimized and experience their own harms. This category of psychological and psychosocial harms seems to be the most prevalent overall following an MVT event. With these significant harms related to MVT victimization, it's clear that this crime creates a significant need for victim support and generates complicated recovery processes for its victims. So these emotional responses and related mental harms that we're talking about can change over time. Most victims will actually recover from psychological symptoms on their own. Estimates from individual studies vary, but on average, about 30% of MVT victims will develop clinically significant psychiatric disorders such as PTSD, depression, or a substance abuse disorder after experiencing a mass casualty event. Not everyone has the same likelihood of developing PTSD after experiencing an event like this, and much of the literature surrounding victimization focuses on these factors that may or may not contribute to someone developing chronic PTSD symptoms. Risk factors for PTSD include the extent of prior exposure to trauma, the degree of exposure to the traumatic event in question, traumatic loss associated with the event and outstanding, and pre-existing emotional regulation strategies, such as the tendency to ruminate and catastrophize versus maybe lean on support networks. For those who do develop it, PTSD is a major consequence of MVT victimization. New or additional traumatic experiences can further exacerbate this distress. Media exposure can also affect symptoms of PTSD. Being approached by reporters, repeated exposure to the event, and consuming incorrect information as investigations develop can really hurt a survivor or their family's ability to navigate their post-traumatic stress. We pulled a little quote here from the Office of Victims of Crime to say, so memories of these extremely frightening MVT events, trauma memories, are stored in a different part of the brain than any other type of memory, and people must completely redefine themselves in the aftermath of a traumatic event. So this really illustrates one key thing to keep in mind as we're moving through these harms. The extremely traumatizing nature of MVT events can spark a completely different reaction of brain chemicals as trauma memories burrow down into survivors' brains and the brains of their family members, and this can really complicate the recovery process. So in addition to immediate kind of bodily harms, both physical and mental, this victimization type does bring economic harms. So MVT victimization is linked to hospital costs, funeral costs, legal fees, structural damage, strain on municipal budgets, and lowered workforce participation, in addition to lost business revenue. Paying for hospital bills and funeral costs, in addition to some legal costs associated with insurance or maybe class action lawsuits, although there's not traditionally the kind of prosecutorial piece that some other criminal types may bring. These costs do put an additional strain on MVT survivors and their families and can really make recovery more difficult. Families whose loved ones did not survive an MVT event may further experience complications to their grief as they navigate these sudden financial responsibilities, and there could be further expenses in kind of traveling or to reach the family or provide caretaking responsibilities, etc. Damage to buildings, both an economic and communal harm, can be a visible marker of the cost of MVT victimization. Local city or county budgets may be strained by first responder overtime costs, rebuilding costs, or costs associated with establishing new MVT victim support programs following an MVT event. The psychological harms of MVT events can also cause functional impairment for victims in their social and work-related domains. In a study of adults who sought treatment for mental distress following 9/11, PTSD symptoms were associated with higher levels of socio-occupational impairment, measured by factors such as the number of missed work days, effects on the productivity level, and conflict with coworkers, which is a really interesting piece that sometimes gets overlooked. While there's not systematic data on cost from MVT events on municipal budgets, rebuilding costs and overtime, as mentioned, may be significant, but additionally, business owners may incur costs from physical damage to their properties or from lost business when their homes or businesses are not accessible because they're within the perimeter or associated with a crime scene. And finally, communal harms. So MVT events are public in nature and often happen in some environments significant to the town or city or county that they're taking place in, such as a public park, a shopping mall, a school, etc. MVT events impact more people than a single assault and require a municipal response. This scale of MVT events generates community attention, and the recovery following an MVT event is not just isolated to victims, survivors, and their families, but can rather affect entire communities, entire neighborhoods, entire groups. So communal harms of MVT victimization may include loss of sense of safety, collective grieving, a significant number of casualties requiring burial and remembrance, damage to buildings, heavy law enforcement involvement that could disrupt communities and or require additional funding, strained or overwhelmed health and mental health resources, strong public fear, closed workplaces and schools, evacuations, and months-long municipal cleanup. So the thing that's interesting about this victimization type is just the massive impact it can have on so many different people and so many different facets of a community, which may be something kind of different than if there is a shooting that only affects a certain family or something like that. So there are a few other MVT-specific harms, and so I'm actually going to turn to Kathryn here to have her chime in a little bit and speak about what modern developments in media coverage and social media have done to the recovery process for MVT victims. So Kathryn, if you'd like to chime in.
Thanks, Melanie. It's no secret that we live in a world of instant media, social media, and visual and audio images. Many forms are legitimate, but others have been manipulated or intended to manipulate the public. These have become inevitable in mass violence and terrorism events, and exposure for victims and families can take a number of forms. The first is media coverage, social media, or text that may alert them to an attack. The speed of media these days means that information, accurate and inaccurate, may reach them before they hear from an official source. Images, audio, video from the scene of the attack, often while it's happening, that can be quickly uploaded to social media and provided to news organizations that are competing to get them. This is another factor, as we've all seen it, and it continues to be more of an issue. Media outlets will pay a lot of money to get these the audios and videos. Families and friends may receive phone calls, voicemail messages, or texts from injured or dying victims, or from other people who are present with them. Recordings of victims who called 911 may be released to the families and to the public, depending on privacy laws in a particular state. Attacks may also be captured on security cameras. Sometimes last images of victims going about their business before they're killed, or injured are also captured on security cameras. There may be images made by victims and others at events prior to an attack. All of these may have significance to the survivors and to the families of those killed. Images, audios, social media postings by perpetrators, such as pre-attack manifestos or statements, and videos holding weapons that they will use to kill, injure, and terrorize victims, have also become more common. Some of this media are immediately available and initially unavoidable, often early on when families and other loved ones are desperate for information. Other forms may be recovered as part of an investigation and potentially shared with victims and families to help them understand what happened. Another thing that we've seen over recent years is that coverage of high-profile mass violence and terrorism events can result in victims and families receiving unsought contact from the public. Victims' names become known, families or survivors may give interviews, they may post information online or speak about what they believe are needed changes in the wake of a tragedy. Many people from the public will be sympathetic, others will be blaming, cruel, insulting, threatening, and intrusive. Deniers and truthers are also becoming more common, as is the physical manipulation of photos and videos online. For practitioners, this raises some interesting questions. What exposure may be helpful? How much exposure is too much for teens, for children, for adults? And most importantly, what is the role of victim service providers in helping victims and families make informed choices about what they see and what they read and what they hear? Thanks, Melanie. Back to you.
Yeah, thanks for that, Kathryn. It's really great kind of additional context, and that new piece is always great to add in here. So just to close this slide, it's important to note that there are significant amounts of trauma incurred by first responders working to secure the scenes of MBT events and support victims during them. For those who do develop it, PTSD can be a major consequence of MBT victimization. Post-violent stressors and adversities can deplete coping and emotional resources and interfere with recovery from PTSD for first responders. Media exposure can also affect symptoms of PTSD, kind of like Kathryn was talking about. And so with that, we're going to actually skip this poll quickly, but I promise we'll have more time to interact at the end of the presentation. So we're going to talk finally about risk factors for severe harms. So although we were talking earlier about how there are not really individual level risk factors to be victimized by this event type, there are some factors associated with experiencing more severe harms following an act of mass violence. So trauma exposure is the degree to which an individual experiences, witnesses, or is confronted with actual or threatened death or serious injury to self or others. Although conventional wisdom may suggest that people become more resilient with each traumatic experience, research suggests actually that the opposite is true. The greater the exposure to trauma, the more severe the psychological disturbance. Experiencing multiple traumatic events can magnify their harms for an individual. Trauma exposure is important to understand both to identify individuals who may be more vulnerable to the harms of MBT victimization and to consider how these events may have cumulative effects on first responders, like the last slide mentioned. Age is also a factor in the recovery process following an MBT event. Young kids may not understand MBTs and feel a constant fear or anxiety because they don't understand that the threat is no longer happening. Further, these reactions by kids, youth, and teens really are influenced by how adults around them are responding. Young people are also not immune from developing PTSD, and media exposure may play a role in their doing so. In contrast, older adults are more likely to be resilient in the face of life challenges and trauma incurred from an MBT event. However, it's important to note that certain events, such as losing a child or grandchild during an MBT victimization situation, may affect older adults more severely. Following the 2012 Sandy Hook school shooting in Newtown, Connecticut, mental health professionals and researchers actually found that grandparents were extremely affected by the devastation of losing their grandchildren. Finally, marginalized communities and regions with fewer municipal resources experience more significant challenges to recovery following an MBT event. Indigenous and Native communities in particular face unique risks experiencing and responding to these events, such as a lack of readily available emergency infrastructure, barriers to collaborating across law enforcement channels, and delays in allocating response resources to reservation areas. So with that, now that we've moved through all of kind of these harms and consequences, I'm going to turn it to Emily to talk about responses and interventions following an MBT event.
Thanks, Melanie. So one of the things that distinguishes MVT events from other types of crimes or victimization is the scale of the event, which typically requires a coordinated cross-sector approach. And for that reason, we wanted to cover not only interventions for individual victims, but also an overview of the overall response process. So we organized this section around the three-phase response framework outlined in OVC's Mass Violence and Terrorism Toolkit. First phase, partnership and planning, should occur before an MVT event even happens. The second phase is the immediate response after an MVT event occurs, and the third phase is the longer-term recovery. The scene after an MVT event can often be chaotic, so it's important to develop protocols for response ahead of time, including victim assistance protocols, protocols that can facilitate medical assistance, coordinate with law enforcement, contact family members, and develop victim lists, among others. These protocols should be integrated into existing local, state, and federal crisis response plans, but they should also be adaptable to different scenarios, given that no MVT event is the same. Another thing that can be done during the planning phase are risk and capacity assessments. Risk assessments can identify procedural and structural vulnerabilities within a particular facility, and capacity assessments are kind of the flip side of that, where you identify capabilities and resources of a facility or community. So for example, this could include identifying people who have first aid certification, search and rescue training, counseling and mental health expertise, or the ability to assist individuals with disabilities. It's also really important that partnerships between service providers, states, and localities are formalized ahead of time, ahead of an MVT event, so that service providers can get on the ground quickly. And at the same time, the large scale of MVT events means that service providers and jurisdictions should be prepared to build capacity for a variety of victim services, including medical, mental health, and other victim assistance. This is often a continuing challenge, especially in rural areas, but one way to increase capacity is to ensure that all staff are trained on disaster and trauma-informed care so that they're able to respond if needed. The response phase happens within the first 48 hours after the event. And this is when the protocols that were developed during the planning phase are implemented. So of course, this includes emergency services and healthcare system response. And because MVT events are so unpredictable and rare, it's difficult to evaluate response strategies, but some initial evidence has suggested a couple of potentially helpful strategies, both of which focus on coordination and improving access to timely medical care and treatment. So joint rescue task forces allow EMS and law enforcement personnel to operate jointly at an MVT scene rather than EMS having to wait for law enforcement to secure a scene before they can enter and start providing medical care. And then trauma systems are networks of healthcare facilities within a region that sort of connect with each other to be able to distribute care to victims more efficiently. Family assistance centers are also a key component of responding to MVT events. The goal of these centers is to provide sort of a one-stop shop for information, collect information for victim identification, and coordinate access to services. They can help with service referrals for mental health counseling, healthcare and childcare, victim compensation, financial planning, insurance benefits, among other things. And one thing that's been found to be really helpful in these centers is creating a victim navigator position so that each victim or family is assigned one point of contact who can help them sort of navigate the system, and they have one person that they can build a relationship with. And the final phase is the recovery phase, which may continue for months or even years. and focuses on providing longer-term ongoing services. So sometimes a family assistance center may be converted into a community resilience center, where the focus is on meeting longer-term victim needs, such as vocational rehabilitation, job placement assistance, and services for those coping with vicarious trauma. The recovery phase also includes individual interventions to address psychological harms. Although there is a need for more rigorous evaluations, there are a few interventions that have shown some promise. Two of these are psychological first aid and skills for psychological recovery. These are provided early on in the recovery phase, and these are typically sufficient for most people experiencing mild to moderate distress. So rather than treating psychological disorders, the goal of these interventions is to help prevent longer-term psychological harm by reducing initial distress and building coping skills. For people who do end up developing longer-term PTSD or depression from exposure to an MBT event, trauma-focused cognitive, behavioral, and psychotherapies have the strongest evidence for them. In particular, prolonged exposure therapy, which is where people process trauma by exposing themselves to a situation that causes fear or anxiety, either directly or through sort of retelling of the event. And also cognitive processing therapy, which is where people identify and modify problematic beliefs that they have stemming from the event. And both of these have been shown to improve PTSD and depression stemming from exposure to MBT. And then although grief support groups typically can't address underlying PTSD or depression associated with trauma, some victims have cited them as a helpful source of support. Well, they've also said that these tend to be the most helpful when everyone in the group has had a similar experience. So they've not only experienced the same event, but also had a similar type of exposure to the event. So you might have one group for families who've lost a loved one, but a separate group for people who were injured in the event. Finally, in most states, victims and families are eligible for compensation to offset expenses related to MBT events, such as funeral and burial expenses or medical treatment. However, the availability and eligibility criteria for victim compensation funds can vary by state. So there are some federal level programs that have been created to fill some of the gaps, including the FBI has an MBT emergency fund that can be used for this purpose, as well as OVC's Anti-Terrorism Emergency Assistance Program. So clearly there are many aspects to planning for and responding to MBT events. And Kathryn, you spent much of your career building up the FBI's Victim Services Division to provide more robust responses to events like these. Can you talk a little bit about the common challenges you encountered in responding to these types of events?
Yes, thanks. In looking back across more than 40 mass violence and terrorism events going back until about 1995, my colleagues and I have learned several key things. First, there are victim-related issues, needs, and challenges that are common across all events, as are tested solutions that can be tailored to any event. Also, every event will have unique needs and challenges that will require quick but thoughtful and creative solutions. So some of the major challenges that we've seen in almost every event is, as you mentioned earlier, the scale of the event is going to determine the level of response needed, and also the resources of the community are going to determine the ability to sustain that response as long as it's needed. Some of these events have happened in large communities that are well-resourced with victim services programs in system-based and nonprofit and community-based. We've been to communities where there's almost nothing, where there are no victim services programs. There aren't victim advocates in a lot of the key agencies that will be responding. The first 48 hours will burn out a lot of the initial victim service responders, so that's something to consider. That's where access to force multipliers, mutual aid agreements with other jurisdictions, national and regional resources for support, such as the Red Cross or the FBI's Victim Services Response Team. Identifying victims and any special issues related to the victim population is really going to be the cornerstone of planning. The victims of any event could include, as you've mentioned, injured, deceased, and present and not injured individuals and broader community who may live in the area or be present. Were the victims known to be at the scene when the attack occurred? So there's kind of what we call a closed population that's easily identifiable, or does it involve a venue with an open population of hundreds or thousands of people? Are there cultural, religious, or gender issues? Some of these attacks have happened in churches and synagogues, in a nightclub that was frequented by LGBTQ victims. So the responses have to be tailored, again, and adapted to meet the particular issues of those communities. Information means a great deal to victims, and it needs to be timely, accurate, and official, delivered in a sensitive manner. And most of this initially is about the status and location of victims, where to go for immediate assistance, and other issues. One of the trends that we've seen across mass violence events has been death notification. A community may be able to handle death notification very well in a particular homicide or a small case, but in mass violence cases, it's been complicated and it hasn't always gone well, and it's ended up alienating families. There's a flow to these events from the process of reunification and notification that's followed by emergency services provided through a family assistance center. Some people call it a victim resource center, depending on the population of victims. And this is to be followed by transition to longer-term information provision and support services. The timing of each of these processes are going to vary by event. Monitoring, managing, and coordinating the response among agencies and organizations is a key issue. That is where it becomes really important to have the key agencies and organizations, at least some of their leaders or senior people in a room, monitoring and managing the response, identifying gaps and resources, and responding to those surprise challenges that are going to come up in every case that you can't really plan for in advance. In every event, recovery, cleaning, and return of personal effects has become a big issue. If you've worked with homicide families, you know what it means to them sometimes to get back these very precious or valuable items. They might not be monetarily valuable, but have emotional significance. It can be overwhelming for a community. Once again, there are some resources, including the FBI's BSRT has an expertise in this area and a lot of resources. Case briefings. Victims are going to want to know kind of what's going on in the investigation. They want to know what happened. And so coordination with law enforcement, prosecutors if they're involved, and others, coroner's offices, to keep people informed about the criminal justice process. Another issue is self-care and the need to monitor the well-being of victim services providers and other responders. People get so caught up and they're so committed and will work themselves to the bone, long hours to be able to respond to the needs of victims. So someone needs to be looking after them and encouraging self-care and encouraging people to work short shifts and get some rest. And ultimately, there is an impact on routine victim services work in communities that have experienced these events. So that's something else that has to be adapted to and dealt with when it's over, particularly. Every mass violence and terrorism event is challenging. We hope to never experience another one on the unprecedented scale and complexity of 9/11. Almost 3,000 deceased victims and thousands of their family members, multiple impact sites, and inconsistent responses and resources for the victims by site. A victim population that included aviation, civilian, and military victims, as well as victims from all states and over 80 countries. Extreme fragmentation of remains and delays and inability to recover and identify all victims. Phone calls from victims, graphic images repetitively played in the media. Afterwards, commissions, high-profile commissions and reviews of events leading up to 9/11, and ultimately long-term needs with limited-term resources. No government agency is probably going to be able to fund or maintain services for as long as some victims of these mass and violence and terrorism events need it. One of the best things that occurred after 9/11, at least at the federal level, was the creation of a national coordinating committee the day after 9/11. That committee met daily for months, by phone or in person. It included OVC, FBI, DOJ, the Defense Department, Center for Mental Health Services at Health and Human Services, FEMA and NTSB, Red Cross headquarters, and state crime victims compensation programs in the affected states. This group coordinated resources, maintained and distributed a matrix of agency authorities and resources, 800 numbers, websites. The committee was able to identify evolving issues and needs and adjust the federal victim services response accordingly. I haven't seen this kind of coordinating body in a lot of the local mass casualty events and even some of the others that have occurred over the last 20, 30 years. But I strongly encourage any community or state developing mass violence and terrorism response plans to include this type of coordination or management team. Thank you very much.
So thanks so much for sharing that, Kathryn. We really appreciate hearing your expertise. It's definitely something that as researchers we couldn't begin to speak on, and I really value that. Thanks. And we are almost to the end here, folks, so thanks for sticking with us as we all learn together. I'm now going to discuss key takeaways from our synthesis review, and I'm going to try and speed through this so we get some Q&A time at the end. But while our synthesis is an objective review of the evidence in the field, we did want to highlight 4 key takeaways we identified after seeing them pop up in patterns across the evidence we reviewed. So we found a lack of broadly agreed upon definition of mass violence and terrorism, limits measurement of MVT victimization, and estimates often don't include victims who experience psychological, economic, or communal harms like we talked about. Risk factors for experiencing MVT victimization tend to occur at the community level rather than the individual level. MVT victims experience physical, psychological, economic, and communal harms. Effective response requires planning and partnerships. The nature of MVT events means that local responders and services are likely to be overwhelmed. And where the field needs to grow, we found in our review, we identified several areas where MVT research and practice fields may have some gaps and could grow to better meet victims' needs in the future. So in the practice side, one of the earliest things we noticed was how obvious it was that most U.S. publications about responding to MVT events draw directly on experiences learned from 9/11. While this is great, much of the literature out there was published in the early 2000s following the Twin Towers tragedy, and it would be interesting to see how the field shifts as these materials are updated to better reflect the most common form of MVT today, mass shootings. Practice evidence was clear across the board in demonstrating the inherent difficulties with coordination and collaboration following an MVT event. These issues may be further complicated by the fact that the response protocols these teams are using have not really been validated or evaluated in any research-based way. So insights from the policy side of things, our review of evidence returned up 2 significant takeaways relevant to public policy, which could maybe inspire future work on these bits. But the rarity of MVT events often creates barriers to developing effective and complete preparedness and response protocols, which kind of how Kathryn was just talking about. National guidelines that describe the most effective and important components would go a long way toward ensuring consistency in local response to MVT events. Further research is also needed to identify the MVT response policies and practices that can mitigate the harms experienced by victims and their families. Additionally, policymakers should look to extant and emerging research to try and limit MVT events. There are factors at the community level, including limiting access to firearms, that researchers have demonstrated would decrease MVT victimization, although this was not the central focus of our synthesis process. Finally, emerging insights from the research field. So as with any academic topic, there are still pieces of the MVT puzzle that are missing. More research is needed to give us a full picture of MVT and how to best respond to it. Most significantly, the field currently lacks clear consensus on both the definition of mass violence as well as the extent of victimization. Differing definitions create challenges in identifying and comparing prevalence statistics and measuring them over time, as you may have noticed as we've moved through our prevalence section. In addition, every study we identified measuring the extent of victimization counted only those victims who were physically injured during an MVT event, even though responding agencies and service providers typically take a much broader view. This has resulted in a systematic underestimation of the number of people actually harmed by a given MVT event. Getting a better understanding of MVT prevalence and the reach of harms a single MVT event may generate would allow service providers to better support victims, in addition to better informing public policy. More research is also needed to determine how many people experience these psychological and financial harms from MVT events, the prevalence of MVT victimization among population subgroups, and whether and how the impacts of MBT differ by demographic characteristics such as age, gender, or race and ethnicity, or the presence of pre-existing vulnerabilities such as socioeconomic disadvantages or prior justice involvement. So, thank you so much for moving through that final takeaway with us. And we do have a little bit of time. I just want to say thank you again to all our participants. It's so awesome to be able to share with you today and hear a little bit about your own takeaways and questions via the chat, and we are going to get into that shortly. But just as one final exercise all together before we move into the questions period, please click the raise your hand button if you think there may be gaps in what we know about MBT based on all the synthesized evidence that we discussed today. If you have specific ideas for future research or unmet needs you noticed, feel free to drop them in the chat and I'll read some aloud as you raise your hands. We'll spend just a minute or so doing this before we move to Q&A. I'm seeing a couple of hands raised, and I tend to agree there may be some gaps and some that we even missed in this presentation. Absolutely. Does anyone have any that they'd like to drop into the chat? If not, we can move into the Q&A. Importance of peer support to survivors, people who live on islands, absolutely. That geospatial influence is definitely going to be big. All right. Great. Thanks so much, y'all. So thanks for that, and that wraps the end of our content today. We'd now like to open the floor for about 5 to 10 minutes of Q&A. So Susan, if you'd like, I'm going to move this presenter ball to you for a little bit to introduce some of the questions you may have compiled for us.
Great. All right, we have had some questions come in, and folks, remember to choose all participants or host presenter panelists for your continuing questions. And I apologize that not all of you have been able to see one another's chat. Our service provider recently upgraded, and apparently there are still a few glitches in the system. But please do enter your questions. I will cover some of the things that have already come in. So the first of those, or actually two of them, relate to the scope of the review. Why did you choose not to include bioterrorism or things like mass vehicular homicide or incendiary devices? Or did you include mass vehicular homicide? I may be wrong about that.
I can take that question, if everyone still hear me. So yes. There was definitely, so to answer the first point about bioterrorism events specifically, so there's a wide array of MBT types, and we needed some way of focusing the resources that we had available to us kind of internally on this first CVR synthesis topic. So bioterrorism events have a very unique characteristics that distinguish themselves from mass shootings, which as you may have noticed, dominate the literature on MBT research and practice evidence that currently exists. So we decided to exclude them because the articles we did find were a little bit more few and far between, and they were very specific and kind of outside of the context of everything else we were talking about. So they were very specific. This is how you handle anthrax, et cetera, et cetera. But we agree that a synthesis on that type of MBT event and other kind of tangential ones would be definitely worth of exploring. As far as mass vehicular homicide goes, we did not do a specific search term for that, but to my recollection, and Emily, correct me if I'm wrong, because we use the terms mass violence and a string of other search items, that did come up within our research. And
Great, thanks. Let me go on to another one. Folks, we are about to, and Emily says they did not specifically exclude that. We are going to launch our exit poll, but remember you can easily get back to the chat box to continue to ask your questions. Several people asked whether anything in your research came up regarding COVID or pandemic conditions, that it may reduce the incidence by fewer people gathering together, or it may affect the response because people can't gather together. But have you seen anything come up that relates to COVID or other pandemics?
Absolutely. So that's super interesting, first of all, and I think definitely where so many of our brains are at right now. But unfortunately, when we pulled our synthesis and did the coding scheme, the most or the most recent evidence that we used was from January, February 2020, so nothing specific to COVID in the US. And I don't believe we saw anything else about kind of extenuating circumstances like a wider pandemic. But I'd definitely be interested to hear more about how the field's been impacted. Kathryn, Emily, I don't know if you have any thoughts?
Kathryn, I think you had a thought about COVID and how pandemic might affect response to MVT.
And Kathryn, if you're trying to answer, you are still on mute. All right, while we're waiting for Kathryn to come back online if she's having an issue, another question that came up, when creating this synthesis, did you find research about why the early response to victims, such as within 72 hours, was important? That number seems to come up a lot in crisis literature and tips, but the questioner is not sure where that originated. Did you see anything about research supporting that early intervention and the link to fewer long-term symptoms?
Yeah, so I think that's referring to the early psychological interventions.
I believe so, yes.
Okay, so I didn't see a lot necessarily of 72 hours, but definitely there was a lot of evidence discussing the efficacy of early interventions, and again, it is related to sort of what I was mentioning with the psychological first aid and the skills for psychological recovery. Those are meant to prevent longer-term psychological harms down the line by reducing distress and improving coping skills. So providing those types of interventions earlier on does help to reduce further harm down the line. I think that is what they are referring to.
Okay, great. Another questioner wondered if you could speak to the importance of having a fair, transparent, single source of survivor funds set up in the aftermath of MVT events, something that ensures that the funds are going to the victims and families, or anything that relates to including that piece in the pre-planning. Did you come across anything about that topic?
We didn't, but there is something, but I do see that's a great question. And Kathryn had some points about the sort of inequities, I guess, in victim compensation depending on state eligibility requirements and how the federal system can kind of create more consistency in that area.
Yeah, this is Kathryn. I think it's difficult, although in recent years, most states, fortunately with OVC support, have tried to treat their victims of mass violence and terrorism events in their states as equally as possible. What we've found in most of these incidents, the victims aren't all local. It's rare. I mean, in probably maybe a third of the cases that I've seen, you have people who are all from that community, but it's more likely that they will at least have family members somewhere else. We live in a mobile society, so sometimes victims, in the Vegas shooting, for instance, about 90% of the victims were not from Nevada, so that presents challenges in a lot of things, but particularly in trying to provide compensation. Some states will cover their citizens if they're victims of crime in another state. So it is complicated in terms of what's available. The state compensation and any federal support will always kind of be one separate thing. I think the idea of the one source of a fair and managed system for putting together private funds that have been donated for victims and families is a good idea. I know after 9/11, it was very confusing in several other events because there were so many different options for families, and it was confusing as to who was eligible for what. So I think that topic, that concept is great and would be very helpful. But there's always going to be a separation between what's available from government and insurance and what's available from the private donations.
Speaking of which, we had a comment that some communities have partnered with the local United Way for donation management. We also had a question: how does income inequality and gun availability each correlate to mass shooting events in terms of offender profile? Did you look at that at all in this victimization synthesis?
So we didn't look much at the evidence for offender profile, mainly because we wanted to focus the scope of this on victimization and the response to MBT. But in terms of the direction of the relationships, it was more income inequality was associated with higher levels of mass shootings, and also more permissive gun laws, or like greater gun availability, was also associated with higher levels of mass shootings.
Yeah, and I just want to second Emily on that. So again, we weren't specifically looking at kind of perpetration characteristics, but one of our sources that we did review, Kwan and Cabrera 2018, which you'll be able to see in our bibliography that will be released on the CVR website, does specifically look at this association. And it's important to just remember that kind of what income inequality may lead to are those resource deprivation, that difficulty in receiving proper mental health treatment, that association with underemployment, et cetera, that may lead people to express grievances through violence, but not necessarily that, you know, income inequality in of itself leads to. So it's definitely an interesting study deserving of more attention, but that was not the focus of our synthesis.
Thank you, Melanie, and thanks for reminding people that you will have a full report and a bibliography that will be coming, that will be, links will be sent out to everyone who registered for this event, and they will also be posted on the CVR's website. With regard to financial support for victims, we had another comment that there may be caps on certain benefit types that are provided, which may limit the amount of compensation available to victims at the state level. We're all aware that victim compensation programs often have caps on different categories of expenses or caps per claim and so forth. We had another question. Can you elaborate on how to change the media coverage of mass violence and terrorism? You all were very clear about the harms that can result from the way we currently cover, our media currently covers those events. How and what should be reported? Do you have any ideas? I know if we were all together in one room, everybody would look at each other.
I know. I was thinking, Kathryn, you have any ideas?
You know, there are a number of journalism schools and organizations that have tackled this issue a little bit. And I know that OVC developed a couple of publications in the past on working with the media following these events. For the Timothy McVeigh and Terry Nichols trials after the Oklahoma City bombing, there was a coalition that was put together between victim service providers and the national and local media in Denver to lay out plans about how to fairly cover the trial and how to particularly interact with victims and families. I've seen some people on the participants list who are probably involved in that and could speak to that better than I can. But I think with regard to the national media, the more reputable organizations, the larger organizations, I think do have kind of a code of ethics that they use. I've talked to some of them about it. In these situations, there are always going to be those media outlets that are not going to follow those kinds of rules. Again, I think the best thing that people can do, particularly victim service providers, is try to work with families and survivors to help them understand that they have rights to decide how and when they want to interact with the media, and that they should be aware of the potential impact on themselves and their families, including their children, from being involved in a high-profile event. They had no choice in the matter, but they they can maybe take steps to determine how much they want to be engaged and how they want to protect their families and themselves.
Thank you. The CVR librarian has reminded us that the National Mass Violence Resource Center has amazing guidance on media coverage, and she sent me the link, which is now in the chat box. I hope you all can see that. Otherwise, we will try to include that in the email that we send out. Another question is, one of our participants is curious how the proximity in time between one MVT event and another, or between MTV events, affects the response. Does fatigue come into play? Are there other issues where you have, where the community may not have completely resolved the first incident and then there's another incident? Did any of the literature speak to this issue of proximity between mass violence or terrorism events?
So literature definitely spoke to what's called a dose-response relationship in terms of that trauma exposure I mentioned. So the idea that if someone is exposed individually to multiple traumatic instances in a close period of time, you're getting more doses, you are going to have a more significant response and a more significant harm experience. But in terms of, and apologies if I'm hearing the question incorrectly, but as we also noted, there isn't a relationship between like the speed of events or the time horizons between events and the likelihood of another one happening. So I think really what the research kind of indicated, although it didn't name it directly, is that when these things are close together, they are more traumatizing, which is difficult for individuals to respond to. And of course, when they're close together, that takes a lot more response resources and a lot of intentional planning and kind of game plans, which are going to put strain on resources available and make that recovery and response more difficult.
Thank you. Another question has come in regarding the FBI's Victim Services Division. With an increase over the years in mass violence and terrorism events, are any of you aware of any plans to expand the Victim Services Division and the Victim Specialist Program?
I can be corrected by my colleagues at the Victim Services Division now, but the program has grown. Initially, when I was there were like maybe 30 people. Now there's close to 300. The Victim Services Response Team for Mass Violence grew from about 20 victim specialists and VSD staff to now over 80. And it's multidisciplinary. It involves victim specialists and VSD staff and specialists, as well as agents who are trained to handle tasks related to the victim response, and analysts and management and program specialists who work on developing lists and doing logistics and emergency funding. So it has grown over the years, and I think will continue to grow. The FBI Victim Services Response Team will respond when the event is terrorism or the FBI has a major investigative role. Thanks to the Investigative Assistance for Violent Crimes Act, which was passed after Sandy Hook, the Victim Services Response Team and the Victim Services Division assets are things that local communities can request and the FBI can provide. It provided legal authority for the FBI to provide evidence recovery, SWAT response, victim services response. And in recent years, more and more communities have requested that support. They come in a support role to the local community to help them manage the response, supplement their response, and then the goal is to try to leave those communities in the best position possible to continue to manage the overall response.
Thank you. That's excellent news to hear. We had another question, and I think I'm just going to start by directing it to Kathryn. Kathryn, who makes a good navigator for victims in these systems, and where can a community find these kinds of folks?
You know, the navigator positions I saw first created after Boston, and that was through MOVA and the folks up in Massachusetts who did a great job in their Family Assistance Center, and particularly in their Resilience Center. I think it took a little while to create the navigator positions. They weren't available right away. But they were primarily, I think, people with victim services experience who understood the impact of victimization and the types of resources that are in assistance that are available generally for victims and their families. So, you know, ideally in a family assistance center, you could have somebody who could meet a family or a victim, a survivor who comes in and help introduce them to all of the different resources, help do a needs assessment so that they're not necessarily just wandering from resource to resource trying to figure out what they need. But I would think primarily the navigator would be someone who has at least some victim services training, social services training, and understands trauma.
Thank you. We had another question come in. Did any research mention the effect of mass violence and terrorism events on holidays or other annual events that are generally considered joyous? This commentator was born on September 11th, prior to 2001, and her birthday has never been the same. She said she'll always wonder how others deal with MVT events that fall on what were otherwise considered joyous days. Any comments?
I think holidays generally are difficult for victims, but I think, you know, those where there's an MVT that falls around a holiday, or it could be a vacation. It could be a very happy, anticipated event, whether it's going to a concert or it's a family vacation in Nice, and all of a sudden a truck comes barreling down the promenade and kills, you know, 2 American victims, a father and a son, whatever. So, you know, I think there's a lot of good information out there about just coping with holidays and poignant life events that are impacted or tainted by a mass violence event or other tragedy. So I think that's the best, you know, other than that, I don't know of anybody who's really looked at what happens, you know, when the event happens on a holiday.
Mm-hmm. All right. Well, we've come to the end of our questions. I want to thank all 3 of you. This really has been fascinating. And I want to remind people that we will have the reports and other resources available on our website. And please do take the poll. And Emily, Melanie, Kathryn, any parting thoughts for our guests?
Not for me. Thank you very much.
No thoughts. Just thank you for your time.
Yeah, thank you everyone for joining.
All right, thanks everyone. As I said, please do take the poll and look for a follow-up email from us. Goodbye, everyone.